Hi everyone, my name is Allison Ebert. I'm an occupational therapy student. Thank you for joining us. Today we will be discussing the sequential oral sensory, or SOS, approach to feeding. This approach was developed in the 1990s by a pediatric psychologist, Dr. Kay Toomey, and it utilizes a transdisciplinary team including occupational therapists, pediatricians, registered dietitians, and speech language pathologists. And the goal of this treatment approach is to target problem feeding and eating behaviors. So it first looks at children starting at 12 months and older, and determining if they are picky eaters or problem eaters, and looking at feeding and eating as more than just putting food in your mouth, but as a larger task that includes the use of all of the senses and different body parts, and looking at focusing in on what is causing this child to not eat or to have eating difficulties. So through this approach, one would look at feeding and eating as broken down into 25 to 32 skill-based steps. And learned avoidance and learned avoidant reactions can result from a negative experience by the child in any of these steps. So the SOS approach takes a holistic and biopsychosocial lens to give control back to the child in terms of feeding and eating. And using this approach, the OT or other healthcare providers and caregivers really focus on play-based treatment. And this approach also utilizes a client-centered lens, so you directly tailor and adapt the interventions and the sessions to the child specifically and their needs, as well as the parent or caregiver's needs. So this program is 12 weeks, and it utilizes systematic desensitization. And this works through a hierarchy to help allow the child to gain confidence and be comfortable with feeding and eating. So starting with just being in the same area as a food, so being in the same room, just seeing it, just getting comfortable before interacting with it. And then moving on to interacting by doing things such as touching or smelling, a lot of playing with the food items, and just getting comfortable and desensitized to reduce that a negative avoidant behavior that is previously seen by the child. So moving on to that, to eventually moving through the hierarchy to get to tasting and eating the food that was previously not tolerated by the child. And success through the SOS approach is measured by motivated feeding, enjoyment when feeding by both the child as well as the parent or caregiver, adequate caloric consumption, and improved family functioning during mealtime. So this approach is transdisciplinary, holistic, really works into and fits in the scope of occupational therapy, is very play-based and client-centered, and we will go into some examples of how it would look like to utilize this approach in practice.
Hello, my name is Megan, and I will be discussing the specialized training needed for the SOS approach to feeding. So in order to utilize the SOS approach to feeding, providers must complete an SOS Approach basic training course and certification program. This course is both lengthy and a bit pricey. It lasts for 12 weeks and costs $1,250. Through this course, therapists are able to receive additional training, mentorship, and expertise in order to effectively administer the SOS feeding approach. The information that they are provided includes a global understanding of the SOS principles, information about the intervention, parent education. Through the course, they are able to increase their professional development and demonstrate competency with the SOS approach to feeding. At the end of the course, they are a certified SOS therapist. When they're using this approach out in the field, the term SOS approach to feeding is trademarked, so practitioners must first request permission prior to administering the intervention. Next, Jessica will be touching on the evidence to support the SOS approach to feeding with the pediatric population. We also chose to create a handout that has information on the SOS approach to feeding. This handout acts as a great resource to read more about the SOS approach to feeding. We chose to include the purpose of the approach, why it might be used, who may benefit from it, when it might be used, and what a typical session looks like. We also provided some examples on some interventions that may be used with this approach, which include chewing on hard candy, having a picnic with a stuffed animal, playing games with food. And it's important to always create a comfortable feeding environment for the child. And all of these interventions are centered around play, which is emphasized in the purpose of this approach. We also included how success on this approach can be measured and other ways in areas that besides feeding that this approach can help with, such as personal hygiene, grooming, child rearing, religious and spiritual activities and expression, and social participation. So if you're looking for some quick information about this approach, this resource acts as a great guide to get a general idea of the SOS approach to feeding.
Hi, my name is Megan Dulon, and we're going to be talking about different ways you can utilize the SOS approach to feeding in feeding interventions. So I would like everybody to participate in this if you can. So to begin, I'd like everybody to grab a food item. For this, I am going to be using a pickle, but you can use any type of food item that you have in your house that is readily accessible to you. We are going to imagine that we are working with a child that has an aversion to pickles. This child does not like the smell of pickles. They do not like the feeling of pickles. They don't like the sliminess. They don't like the taste. They do not like pickles. They don't like the color. Nothing. So with the SOS approach to feeding, as we all know, it's a hierarchy of systematic desensitization. So what we're going to try to do is gradually increase the child's tolerance to pickles or whatever their item is in order to eventually get them to put the item in their mouth, chew it, and swallow it. So whenever you're doing this type of intervention, you always want to provide the child with a cloth or something of that sort, paper towel, so that they can wipe their hands, wipe their mouths as much as they need, because the child is the one who is in control of the intervention. So let's begin. So to begin, you're going to do something similar to having the child touch the food item and just getting them used to the tactile input. So you may say something like, okay, we're going to tap the food. Ready? Can you tap? And the clinician will demonstrate what they mean to the child too on their own piece of food that is exactly the same as the child's. And then I would say, okay, you do, and have the child perform this as well. Or you may also have them do it at the same time as you. Maybe, okay, we're going to pretend we're going to play a piano right now. you might pretend to play a piano on your food item or something like that. The whole point of SOS is to really engage children in the ADL of play. So you want to get them as engaged as possible, having fun with it, and being able to at least get the tactile input. You would not move up the hierarchy all in one day. That obviously takes the course over several types of sessions, but I'm going to give you more examples of how you'd eventually move up the hierarchy. So we just started out with the child touching the food item. So next you may say, okay, we're going to touch it on our arms. Can we tap on our arms? Ooh! And you would have the child repeat that as well, and making everything light and fun. And if the child does not want to do something, they don't have to. They're completely in charge of the intervention. Once the child would feel comfortable with that tactile touch, you may say something like, can we smell the food item? And you'd have them, and ask them what it smells like. See what they say. You can kind of gauge a lot of clinical insight based off of what the child talks about or how they react during the intervention. So see what they say. What do they think how it smells? Ooh, that smells sweet. That smells bitter. You can ask them about the color of the food item. And then when they start feeling more comfortable with being exposed to the smell, being exposed to the touch, you can start to have them get it over near the oral musculature. So saying, can you touch it to your lips? Can you give it a kiss? Can you make it a smiley face? Can you give yourself a mustache? And like I said, as much play as possible. And then eventually down the road, you would see, okay, can we take a little bite? And have your child take a very small bite. They can spit it out if they'd like, or they can keep it in their mouth. They can let it sit there, or they can chew it, however much the child feels comfortable with. You may also have the child move the food item laterally and to facilitate chewing. So you might have them put it on one side of their mouth and move it to the other side of their mouth. You may have them lick the food item. And then once they begin to feel comfortable with allowing the food item near or even in their mouth, you can say something along the lines of, okay, we're going to take a bite and we're going to send that down to our tummies, okay? Ready? Let's go. Have them chew and say, we're going to send it down to our bellies on the count of 3. Ready? 1, 2, 3. And then you would swallow. So this is just an example of a food item that a child might have a particular aversion to that you could use the SOS approach to feeding to address in treatment. And these are just some examples of the types of desensitization techniques that you may use. Not every child will be the same. Not every child will like the same type of things, but learning what the child enjoys and what they dislike and learning how to manage both of those things together cohesively in order to best facilitate treatment is definitely beneficial. So I hope you enjoyed this activity and I hope you had a nice little snack. Have a good day.
Hello, my name is Jessica Patzwell and I will be discussing the evidence-based research that we have found to support the use of the SOS approach to feeding within the pediatric population. There has been some mixed evidence to support this approach. In a retrospective study of 34 children with autism spectrum disorder, cerebral palsy, neurological impairment, or a non-specified diagnosis, over the course of 1 to 3 years, researchers concluded that the SOS approach to feeding resulted in improvement in feeding for children with neurological impairments and feeding difficulties, was more effective for boys than girls. 3 other studies were analyzed to determine that using the SOS approach to feeding elicited significant increases in both the positive behaviors during mealtime and foods tolerated, as well as overall positive calorie and weight gains in children with feeding difficulties. Children with ASD and other diagnoses leading to food aversion are at a greater risk for negative nutritional and developmental effects, leading to a need for evidence-based and effective treatment approaches to feeding. Evidence has found many benefits on bringing play, socialization, proper positioning techniques, and strategies to assist children in joining their families and peers during meal times. But because of this limited evidence that we do have and mixed clinical evidence to support the effectiveness of the SOS approach to feeding, further research is warranted. Thank you for listening to our presentation about the SOS approach to feeding. If you have any questions about what we discussed today, the next slide will show each of our names and our emails if you would like to reach out. Thank you and have a great day.
Here are our references.